As fertility treatment progresses, we do have some intended parents that may eventually begin hearing discussions around finding donor eggs. So I'd love to talk more about when that conversation usually begins. So at what point do you maybe begin discussing donor eggs as an option with patients?
So I think that if a patient has diminished reserve to the point where there's not that much, there's very little likelihood of us getting eggs, or they've done multiple IVF cycles and all of them have been abnormal or miscarried or never made it to the blastocyst stage, and it seems like that the egg is the issue and it's definitely not the sperm. So you get to a point where you say, hey, if there is a partner that doesn't have sperm, one option is to use a donor sperm, if that's accepting to you. And it could be anonymous or known. Now, there's a situation where you make perfectly great embryos, but you don't have you cannot carry it for whatever medical reason. There's surrogates. So then in that same light, even though this is not the first option for you, you want to use your own eggs. If it's not possible, at least I'd like you to consider the option of egg donation, which we usually use 20 to 30-year-old, therefore a 65 to 85% chance of getting pregnant. That option exists. I'd like you to think about it. And if that's of interest to you, then come back and we'll talk further. Because I think that first you have to understand it's like we don't want to go through. So basically understanding that there are options that you might not want to take, but if you did take it, has a high success rate. And if you are interested, we talk more, because otherwise the person doesn't listen anyway. So what's the point in talking? But if they want and they're receptive, then we can explain about anonymous versus known, frozen eggs versus fresh, and success rates. And obviously, the patient picks the donor, not me. We're just doing the technical aspect of it. So they feel comfortable with whomever they pick. So most people like to pick someone that is from their ethnic background, eye color, hair color, skin color, whatever. But some people don't care. So that part of it, we leave it up to them. But it's never a discussion that should be had with a patient that is not receptive.
Mhm. Right. Yeah. And I think I know it's a very important decision. It can also be an emotional decision for a lot of patients. And that kind of leads into question 10 as well. Patients do emotionally struggle with that idea of using donor eggs. So how do you usually guide patients through that first conversation?
Oh, I think I just did. I'm just kidding.
You
Yeah, well,
kind of already answered.
that was what we were just discussing, but I didn't know that was the next question. So the bottom line is, but that's the whole way. I think the
Right.
way you do it is by telling the patient that it's not over until you say it's over.
Mhm.
So the way I always describe it is, hey, uh, my job, I'm never going to give up until you tell me, because if there's no sperm, I get sperm. If there's no uterus, I get a uterus. If there's eggs, I get an egg. The point is, you just tell me when to stop, because I'm not going to stop until we get a kid, unless you say that's not how I want to get pregnant and we stop. So I think the understanding is, because a lot of times if it's the egg, and the husband comes in and says, well, of course we're going to go. I mean, the patient doesn't want it. My question to him is, hey, so would you be cool if we use the donor sperm? You
Mhm.
know, how do you feel about
Yeah.
it?
How would you feel
Because I
about
think
that?
it's really hard when you put yourself in that position. Obviously, it's not choice one, two, or three. But if it happens to be the way we're going to get pregnant, it's a gift. Because I've seen so many patients do egg donation, have kids, be so ecstatic about it. I've been to parties at their house. They don't talk about egg donation. They're just so happy to have the kid, until they become 16. Then different story.
When they become a teenager,
Yeah,
yeah.
then you're like, what, doctor? What do you do? What did you do this for?
They'll call you up. You're like, I'm done with my part.
Yes.
All right. So let's go into question 11. So even when embryos are healthy, pregnancy may still not happen. So in what situations do doctors begin considering surrogacy as part of the conversation?
Yeah. So as I was saying before, in surrogacy, you have a patient who, for example, has a medical condition, they're taking some meds where it's incompatible with carrying a baby. That could be one. Or there could be uterine scar tissue that cannot be fixed, or fibroids that cannot be dealt with. Whatever is the reason that they cannot carry medically. And it could be other whole bunch of things. Now, you don't actually have to have those reasons. You can also be someone who says, I don't want to carry. I'm scared. Or, my first pregnancy, I had such a hyperemesis situation. I can't do that anymore, but I still want a kid. So, yeah, because you don't have to have a medical reason. You can have a reason like you want to. That's good enough. You want to. Then there are cases where people who have tried and had multiple miscarriages or problems, and they're like, hey, this could be the uterus issue. I want to put this and my last embryo in a surrogate where that has the highest chance of getting pregnant because this lady has had 6 kids. Now, there's also same-sex couples where they have sperm. They got the egg donor to create an embryo, but now there's a uterus in need. We need a uterus, so that in that situation. So there's many reasons why surrogacy is needed, and thank God it's available. So we don't sit here and decide or judge about why. I mean, I ask, but I'm trying to figure out which category we're in. But it could simply just be that you want to. I had one doctor who got pregnant and had such a complication and had to not work for so long, but she still wanted another kid. So she came and sat in front of me and goes, I'm not doing this, Sam, again. And I'm like, well, okay, you don't have to explain this to me. I got you. I got you. We can do this in a surrogate. And then she got pregnant with a surrogate, continued working, and not went through all those issues medically that she had where she was admitted to the hospital for months, and then the healthy kid. And so I think that the point being there's many reasons, and thank God surrogacy is available.
Right. All right. And then we're going to move on. I think this is our final question.
Do you hand out Tylenol after this? Because I probably give them headache, whoever's listening back there.
I think I think we might have like one question too after this. So
Oh, you do? Okay.
yeah.
Sure.
Someone's listening. All right. So for someone who is already 38, 40 or older and feeling overwhelmed, what would your advice be for taking that first step?
Well, my wife and I are different, right? Because I decide to put my head to something, I just do it. I go on until it happens. I don't take no for an answer. My wife, on the other hand, analyzes everything, what if, and until she makes that decision. So everybody is different, right? But the way I would put it is hope, positive attitude, can do, unless you tell me I can't. Like, just you go at it because maybe it won't work the first time. I know it's hard. I know it's emotional. I know it's financial, but we just keep at it until we get there, until there's a time where you say no. Now, there are some extremes, by the way, but I remember there was a patient that every time she came to office, and I'm like, okay, you know what? I really think we need, like, this is, but she's like, no, we're going. And then finally, on the 7th try, I couldn't have believed that she got pregnant. And I'm like, wow. Well, obviously, when I got invited to the birthday party, and my wife said to me, aren't you proud of yourself? I said, actually, to be honest with you, it's nothing to do with me. The lady is persistent. It wasn't me. So I think that positive thoughts, positive attitude, hope, never lose. And there's going to be a solution. There's going to be something we can do. Because you see, as I said, sperm, replace sperm, egg, replace egg, surrogate. There's always a solution. Now the question is, do you want it?
Right. Yeah, I think that message is really important. We discussed that age does affect fertility, but that doesn't mean that all your options disappear.
Yeah.
All right. And like I said, so now we can move on to the Q&A session. Like you said, feel free to drop any questions in the chat. I think we just have one question here from Paul. How about a surrogate over 40 but less than 45? I guess they're asking about like choosing a surrogate. That would be that age.
Yeah. So I think the question really becomes is, Is there a problem with using a surrogate who's over 40 years old? And the answer is that as we get older, a female gets older and tries to get pregnant, they have an increased risk of hypertension in pregnancy, diabetes in pregnancy, C-section. And so everybody says, oh, she's 42. Can she become a surrogate? And my answer is, well, did she have diabetes, hypertension, or any of these things before? No. So then there's no reason why we would, like, if you gave me another surrogate that was available, great. If not, and if it's only a 40-year-old with 3 kids and everything else is perfect, I don't have any problem with it. So I think the answer is yes, of course, there might be an increased risk. Now, the reason, so I had the displeasure of presenting 30 years ago in front of ASRM the first 63-year-old pregnancy with egg donation. And my boss didn't go because he knew he was going to be fried. So I went. And I started the talk by saying, yes, there's an increased risk of diabetes. Yes, there's a risk of hypertension. Yes, there's a risk of this and that and that. And the risks are doubled. And everybody's like, yes, yes, yes. And then I say, well, this is 2% went to 4. This is 1% went to 2. And everybody just calmed down. They realized, okay, yes, it's double of 2 is 4, but 96 is good. So the point is, so yes, there is some risks, but realistically, it's not a problem. Now, if you were given the option of someone younger, then of course you would pick that person.
Right.
So
Oh,
I hope that answers the question.
yeah. I think we got another question here that just popped up. So this is from Grace. Does day 3 FSH or AMH change? For example, if you had IVF done the cycle before, as I did one at 38, with my AMH dropping from 8 to 2, and now I'm labeled with very low AMH, my FSH being 10.7, does that FSH or AMH change? Sorry, let me know if you need to repeat anything.
Well, my understanding, and I hope I get this Grace
Yeah.
the right way, but basically what you're saying is, can AMH FSH change? And the answer is yes, but can it change this drastically? Unlikely. So it's gonna be a lab error or something, but let's assume it's real. It's usually not this. It's this. It's like over time. Unless we saw this during COVID, where patients who got COVID or COVID vaccine had a drastic drop in their egg count, some medical condition or severity, some severe medical condition that affects that stuff. But just going through an IVF cycle 1 month after the other shouldn't have these drastic number changes. So yes, they go down, but not this drastically. I would recommend them to repeat the tests and have it reevaluated by someone else.
Gotcha. Yeah, thank you for answering that. And if we do get, you guys can ask us more questions when we're closing out. Oh, Grace said thank you. All
Good.
right. So yeah, we will close out now. All right. So thank you again, Dr. Naj, for joining us today and sharing your insights. And thank you as well to everyone who spent time with us today and asked questions. We hope that the discussion gave you more clarity and reassurance as you explore your own fertility journey. Like we said, if you have any additional questions after today, or you'd like to discuss an individual situation, you can always have a consultation with us. And Dr. Naj, do you have anything that you'd like to share? Like what's a good way to reach out to you?
Um, do you have a way of them reaching out to me through you?
Yeah,
That's
we can
great.
definitely do
But
that.
our website is reproductive.org, so that'd be easy.
Yeah, just let us know if you want. You're like, I want Dr. Naj. I'll be like, I got you.
Got it.
We'll send it over. All right. Well, thank you guys again, and we hope to see you very soon. And thank you, Dr. Naj, for your time.
Nice to meet you guys. Bye-bye.
Yeah,
Thank
bye.
you. Bye bye.